All right, closing things out, presenting on behalf of the team at Health eFilings, please welcome Robert Hopton.
Good afternoon. I'm Robert Hopton, CEO of Health eFilings. Medicare is a $600 billion a year expense and is projected to be insolvent by 2030. As a result, Medicare has implemented many new regulations in an attempt to control cost and improve quality of care. And any doctor or provider that submits claims to Medicare is required to comply on an annual basis or they will be penalized. Therein lies the #1 challenge for physicians today. Prior to Health eFilings, the only way to comply was a very manual, arduous process, and as a result, less than half of all providers are complying, resulting in billions of dollars in penalties each and every year. Health eFilings' proprietary software is a turnkey, end-to-end solution that enables providers and healthcare organizations to comply with Medicare's annual reporting requirements and thereby avoid significant penalties. Our web-based, cloud-based software can integrate seamlessly with any EHR. It automates the process that today is being done manually by most. What we do is we offer an opportunity to aggregate, format, and ultimately submit that data on behalf of the physician or the healthcare organization. And is completely turnkey in that it requires no workflow changes for the provider, no IT support from the organization, and no administrative support relative to interacting with Medicare. As a matter of fact, for the 2014 reporting year, Medicare accepted 100% of our submissions on behalf of the providers we were supporting. We are first to market with a solution such as this, and there are certain criteria and credentials required in order to be able to interface with Protected Health Information, PHI. One of those is to be certified by a division of the U.S. Department of Health and Human Services, which we are. Second, the organization has to be fully HIPAA compliant, again, which we are, both of which will slow down any potential fast follower as they see how we've brought this solution to market. Our focus specifically is on provider and physician groups between 10 to 200. That represents about 72% of the market today. Those folks are identifiable and reachable through very cost-effective means to going to market, through participation in various associations and attendance at conferences, through strategic alliances and channel partners, of which we've got a few in place already, as well as through the EHRs themselves who are precluded from offering this kind of service based on the regulations. So we have a very cost-effective way to build our customer base quickly. As a SaaS company, we charge an implementation fee as well as a fee per provider based on the reporting period that we're submitting the data for. By achieving only a 3% market penetration, which is only 35,000 providers, we'll have a $30 million gross revenue and $20 million operating income company. We're extremely confident in our ability to deliver those results based on the extensive and relevant experience of the team. I myself have over 20 years of general management and operating experience. I've had P&L responsibility for multi-billion-dollar operating divisions of publicly traded companies. I was previously Senior Vice President of Cigna Healthcare, and I've been part of 3 previous startups, most recently as the CEO of Idle Free Systems, a company we sold last summer. My business partner, Ben West, spent over 9 years with Epic Systems as a developer. He is the architect of the analytics platform today used by most major U.S. healthcare systems. Additionally, he's advised the federal government on Medicare regulation, and he's a member of the committee that is setting the standards for which our software is actually solving the regulatory compliance issues. We plan to be well positioned for an exit by 2018, with most likely the exit being to a strategic acquirer, somebody as a registry, practice management company, or either a healthcare IT platform company. And based on the data available, the projections are 3 to 5 times gross revenue for the sale of the company. Thank you, and I'd be happy to answer any questions.
Questions for Robert?
Yeah, Robert, maybe just talk a little bit more about the penalty and how many providers are currently, in compliance with this, and which aren't, and how it seems like a lot of them just go ahead and pay the penalty because they literally can't comply.
Yeah, it's a really good question. 2014 and 15 are really a pivotal year in terms of what's going on in the marketplace. Prior to 14, there were no penalties, just incentives to comply. In 14, it was a combination of a penalty of 2% and some incentive, and they got minimal compliance then. In 15, it's now a 6% penalty, which on an average is about $18,000 per provider. And when you look at what the margins are on Medicare-related billings, that 6% can be the difference between making money or not on that service. Right now, the best estimates are only half are complying, and those that are doing it through a manual process known as either claims-based or registry-based. And that can take hours upon hours per provider in order to try to comply, and there are risks relative to accuracy, completeness, and meeting a very tight timeline for delivering and submitting the data.
Robert, what other solutions are out there trying to solve this problem? Because we don't do a lot of healthcare IT investing as a fund, but I know I've seen other people trying to solve this issue.
Yeah. We've not seen anybody else trying to solve the issue the way we are. We have other indirect competitors. So there are registries out there who are the one, think of them as E-Trade brokers, no disrespect to anybody. But basically what that means is the healthcare organization has to extract all that data manually, format it, and then they pay for the right to have the registry submitted on their behalf. So they've got labor costs, taking a trained administrator out of the productive work cycle to do it, and then they pay the registry. That's the only kind of competition that we have today, and that's what we're essentially going to be displacing for that 50% of the market. The other 50% are just non-compliant, and up until 2015, the penalty wasn't significant enough necessarily to get them to comply. Now it is.
Okay, thank you.
I applaud you for hitting on a true pain point in the system where it is today, because everyone's talking about these and as the penalties increase, so it's a good time for this. I was just curious about your market, and you kind of said 10 to 200 providers per system. That's kind of a large range.
Yeah.
And there's a different selling point for a 10 physician practice versus a 200 one. Why'd you pick that, and how do you do it differently based on that size?
Yeah, good question. So first, the 10 to 200 represents 72% of the market. So that's where the lion's share of the market is. The sales cycle will vary a little bit, small versus big, but the means to reach them are the same. So their involvement in various associations, their attendance at conferences, and the same strategic channel partners that we're using to access those customers, they're accessing, so medical billing companies, for instance, they're going in and selling into a practice with 10, just like 200. And so they're basically carrying the bag for us as our way to get to market.
And that's what I was going to ask you. Are you working with channel partners? Because that seems like a good avenue to just bolt on for what you're doing.
Absolutely. We already have 2 strategic channel partners on board and another 11 in the hopper that we're in active discussions with. And that's basically how we're going to build our distribution network.
Okay.
That's either good or bad.
Hearing none. Let's hear it for Robert.
Thank you.